Good afternoon, everyone. I've had the opportunity to use the DRSplus with the RETCAD AI for a few years now. So we're going to talk about how we use it for diabetic retinopathy screening as well as two other diseases. So these are my financial disclosures. So when we do traditional diabetic retinopathy screening, so we have the patients come into the clinic, we examine the retina through dilated pupils, using specialized equipment like a slit lamp or an indirect ophthalmoscope or a fundus camera. This requires trained personnel or actually an ophthalmologist to identify the early stages of diabetic retinopathy. And many diabetic patients may not be able to access this screening due to socioeconomic barriers, especially in our country, the Philippines. So these are the limitations of traditional diabetic retinopathy screening. It is time-consuming, and it could be expensive depending on how much the doctor charges for a consultation. There could be inconsistent results, so different doctors may spend a varying amount of time examining the retina, and it may differ in their findings. And many areas do not even have an eye doctor, especially in the Philippines. So this will lead to a delayed diagnosis. And even if the patient does come for a checkup, repeated visits are necessary to monitor progression. So the iCare has a screening solution. The iCare DRSplus has an automated imaging, and it requires minimal staff training, ensuring a seamless and efficient process of doing the diabetic retinopathy screening. So the captured images are stored in iCare Illume and processed for AI analysis using iCare RETCAD. The patient report is generated almost instantly depending on the internet speed at where you are, and making it readily available for viewing and sharing and for compilation and reports. So the iCare DRSplus is the retinal imaging hardware portion. It is a confocal fundus imaging system similar to using the same technology as the iDome. And it's used to capture high-quality retinal images. The iCare Illume is the AI screening software and workflow. It is a software platform built around automated disease screening workflows using AI and is designed to work with DRSplus. The iCare RETCAD is the AI retinal image analysis engine. It has a deep learning-based retinal image analysis engine that assesses the fundus images for pathology. So the iCare DRSplus is the hardware. It has true color confocal technology similar to the iDome, a white LED light, and it captures high-resolution 45-degree retinal images, and it penetrates some or most cataracts, unless it's very thick, for a very clear visualization of your fundus. It is powered by confocal technology, and imaging of pupils as small as 2.5 millimeters without dilation is possible, and this helps streamline our examinations and optimize our workflow. It is fast, it is fully automated. It can be done with very minimal training while delivering high-quality images and very fast examinations. This is obviously not my patient, but the image on the left is an actual patient of mine, and you can see the quality of the image is very good. And when we compare the images of the DRSplus versus the other fundus cameras, this is shot through undilated small pupils. The DRSplus has superior images compared to other fundus cameras. So the iCare DRSplus will provide different imaging modalities as well. It has true color, red-free, blue and red channels. It can do external eye photos, a stereo view of the optic nerve head, and mosaic as well. A stereo viewer, the DRS stereo viewer technology, will automatically capture two separate photos of the nasal field at different angles and different focal planes, creating improved a 3D perception of the disc. It can also do external eye photography, and the photography and the process is fully automatic. So the capturing of images is just as easy as pressing a button. So when you look at this is the screen, you can press which field you want to take. You can take as many as you want, but the required for the AI processing is a optic disc centered photo and a macula centered photo. So the AI needs two photos to be able to make an analysis. The mosaic function also allows a panoramic view of the retina of up to 80 degrees. By using the mosaic function, it can stitch the photos together automatically. We don't really need to align the photos, it will do it automatically. This is a case of a patient with diabetic retinopathy taken with the RETCAD and compared with a standard fundus camera. So you can see the difference in quality. This is the same eye, the same day, the same patient. And there's a vast difference in the quality of the photos. So the ungradable rate for the DRSplus, meaning the number of photos, the percentage of photos that are deemed unreadable, is only 2.58% for RETCAD. And this is the report that is generated by RETCAD. This is a comprehensive summary of the 3 disease classifications and grading. So it will grade and it will give an AI interpretation of the degree or severity of diabetic retinopathy, age-related macular degeneration, and glaucoma. It uses heat maps to visualize the bright and red lesions and thus make the classification. So the heat maps actually indicate locations in the image which are suspicious for abnormalities. The heat maps show one for bright lesions and one for red lesions. So bright lesions include the drusen, cotton wool spots, and exudates, and red lesions include microaneurysms and hemorrhages, and these are the basis for the AI interpretation. And you get a printout of the grading like this. So the first row is for diabetic retinopathy. This patient was classified as severe DR, no AMD detected, and not suspicious of glaucoma. So in one go, within a minute or two, the patient can be screened for all 3 diseases. So the RETCAD results can have no abnormalities detected. It can have more. If the patient has more than mild DR, the patient is referred to an ophthalmologist or will be recommended to see an eye doctor. If the patient has intermediate or more severe AMD detected, patient is also referred for further screening or further examination. And if suspicion of glaucoma is also detected, the patient is referred as well. So the scoring is actually based on ICDR and AREDS classifications. So these are sample cases from my clinic. So this is a patient with no retinopathy. You can see that the grading is below 1 inside the 0 portion. Next patient has a mild non-proliferative diabetic retinopathy, and patient gets a score within the 1 section. So there's a color spectrum that gives us a grading of how severe it is. And this is a patient with severe NPDR. So again, the grading was placed at 3. And this is a patient with PDR. So when you look at the color photo, there's fine neovascularizations in the red circles, and the patient and the AI read it as proliferative diabetic retinopathy. I just want to remind everybody that this is a tool for screening. It will not replace the eye doctors. So it's very useful as screening, but there are some certain things that it still cannot do very well. They will need to be referred to a doctor. This is a patient who is post-PRP. So the patient was read as a moderate NPDR since there was no neovascularizations noted. However, it does not do very well with pre-retinal hemorrhage. This is a patient with a large pre-retinal hemorrhage but was diagnosed by the AI as moderate DR. However, since anything above mild DR is referred, this patient will not be missed as well. The patient will still be referred and seen by an eye doctor. And this is a patient with traction retinal detachment on the right eye, which was still diagnosed as severe DR. It is underdiagnosed, but will still be screened and will still be referred. So the performance of DR screening with RETCAD and DRSplus is very good. Sensitivity is 97.5% and specificity is 91.1%. So for diabetic retinopathy, sensitivity is 97.5, specificity at 91.1. For AMD, it's 84.4 sensitivity and 95.2 specificity. And for glaucoma, it's 89% and 88%. So the AI actually detects early signs of retinal pathologies instantly and classifies the results according to severity. The AI will provide efficient processing and optimizes workflows. And the AI-driven screening streamlines our workflows, it will cut down our time and effort spent on manual image analysis. And the iCare RETCAD provides human expert accuracy reliably and consistently. So this is what the report will look like on the printout and what the patient will bring home after the test. These are different studies that were done on AI used for screening and for building the database. So one of the clinical papers is DRSplus plus RETCAD used in real-world screening. They showed us a sensitivity of 97.2% and a specificity of 93.7%. And DRS combined with RETCAD demonstrated a high sensitivity and specificity for identifying referable DR on a real screening population with low ungradable rate and supports its use as a reliable DR screening tool. Another study highlighted the DRS plus image gradability and AI comparison. So DRS plus provided good image quality. The AI showed high sensitivity for referral for DR, and it highlights its usefulness in telemedicine, including screening setups. A third paper on RETCAD performance in other clinical evaluations showed that the RETCAD performs comparably to other deep learning systems for DR screening in a diverse clinical environment. So the key takeaways: it has a very high sensitivity for referable DR, 97 to 99%, meaning most cases that actually need referral will be detected. It's a very high specificity, 90 to 94%, and reduces false positives related to other AI systems. It has a very low ungradable image rate due to the very good image quality, and it aids practical implementation in routine screening systems. So the clinical relevance: the combination of using automated and scalable DR screening in non-specialist settings will potentially expand the coverage and reduce the burden on us eye specialists. So in the next couple of minutes, I'm going to talk about my personal experience on using the DRSplus with the RETCAD. I've had the experience of using it in my clinic, and the hospital has a wellness screening program, and we also used in-mass screening programs as well. Before this machine arrived, what we do for retina screening is that the internal med and the endocrine consultants will refer their patients to our clinic for DR screening. So the patient lines up in your clinic, waits for several hours just to be seen. Patient will need to be dilated, and after the patient is examined, patient will need to wait another 4 to 6 hours for the dilation to wear off before he can do anything useful. And this is repeated every 6 to 12 months. So instead, when the machine arrived, we held a meeting and promoted this machine with the IM and the endocrine department, and we made them aware of this technology. So now they make a request, just like ordering a blood test. Patient gets a fundus photo with an AI interpretation, which takes less than 15 minutes. And this is repeated every 6 to 12 months. And only the patients with more than mild DR are referred to the eye clinic. Our hospital also has an executive checkup, so they do CT scans, ultrasounds, blood work for well patients. And they have these packages that the patient can choose. You want to include eye screening, you want to include prostate exams, colonoscopy, endoscopy, etc. So the patient chooses from different packages. So the DRSplus and RETCAD is now included as in a few of the packages for eye screening. This is very useful, and a lot of the patients find it very useful. They don't have to line up and see a doctor. They don't have to be dilated. And it also increases the pickup rate of these diseases and generates more patients for the Eye Institute. We've also had the pleasure of doing a mass screening program for the Vitreoretinal Society of the Philippines. The program is called Mulat Mata, roughly translated to as Open Eyes. And we have here seated in the front row the head of the project, Dr. Drubs. This is a diabetic retinopathy screening project initially funded by Novartis years ago to conduct DR screening in the underserved areas of the Philippines. So we've done this for several years, and in the last few missions we've started using the DRSplus with the AI. So You can see that the setup here, the patients get fundus photos, and we train the local health volunteers to do the test, to do the screening. It takes about 15 minutes to train them to use the machine. It's very easy to use, and the machine is not very big. It's relatively portable. You can fit about 3 in the trunk of your car. And we go to different localities, and I was proud to be part of one of the missions which was done in our city. We've been doing this, and we hope to be doing this more in the coming years as well. So Mulat Mata has garnered several awards, and the latest of which will be the APAO Outstanding Service in the Prevention of Blindness 2026, which will be awarded to Dr. Jubes tomorrow. Thank you.
Our society, the Vitro Retinal Society of the Philippines, has a project called Mulat Mata, roughly translated to as Open Eyes. It is a diabetic retinopathy screening program done in the underserved areas of the Philippines, conducted by the retina specialists of our society. We've been doing it for several years, but the past few missions we've been using the DRSplus with RETCAD, and it has made our workflow and the process so much simpler because we don't have to dilate these patients, and we get a diagnosis and very good image quality in just a few minutes, and just makes the screening so much faster, and we are able to gather data with images after the missions. My experience with the DRSplus has been very good. The image quality is excellent. It can penetrate even mild to moderate degrees of cataract and give us a very good image compared to other fundus cameras. The specificity and sensitivity is very high. It's 97.5% and 91.1%. It's very important because we need to be able to rely on these tests and know that they're accurate once they give us a result. It makes our job easier and makes the workflow much faster, and it's just a pleasure to use.